Hi, everyone, and thank you for joining us today for today's webinar, The Silent Risk at Home, Understanding Radon. As we're letting folks get logged in and get all settled in on and connecting to the webinar today, I just wanted to point out a couple of the features. Down at the bottom, you'll see a chat feature that we will be posting some of the links that people are referring to in that chat feature. We also have a Q&A button. So if there are any specific questions you'd like to ask of the panelists, feel free to use the Q&A feature, and then we will route that to the correct individual at the end of today's presentation. If you are in need of closed captioning, there is also a button down at the bottom that will allow you to enable closed captioning. So just look sort of off to the far right-hand side. Okay, well, good afternoon and welcome everyone to our annual National Radon Action Month workshop and panel discussion. Today's webinar is brought to you by the Missouri Lung Cancer Coalition in partnership with the American Lung Association, the Colorado Department of Public Health and Environment, the IU Simon Comprehensive Cancer Centers and Lung Cancer Now initiative, and all of our partner organizations. January is National Radon Action Month, and all of our organizations are working together to educate residents in Colorado, Indiana, Missouri, and beyond on the dangers of radon and what you can do to protect yourself from exposure. This afternoon's program will feature several panelists, and we will cover the panelist bio later in the program, so you'll have an opportunity to learn more about their work and ask them some questions. But now I'd like to take the opportunity to introduce our moderator for today. Rachel Sanford is a member of our Missouri Lung Cancer Coalition and the chair of the Missouri Prevention Subcommittee for our Missouri Cancer Consortium. She currently serves as the Health Promotions Manager for the American Lung Association in Missouri and is a key part of our Radon Action team. So take it away, Rachel.
Thanks, Sarah, and welcome again, everyone, to our Radon webinar. As Sarah mentioned, we do have some panelists that will be joining us later in today's program. Those panelists are Kyle Davis from Protect Environmental, Dr. Kevin Everett from University of Missouri School of Medicine, Heidi Nafman-Onda from the White Ribbon Project, and Misty Phillips, also from the University of Missouri School of Medicine. Before we review the agenda for this afternoon's program, I'd like to briefly cover the purpose of Radon Action Month. So January is National Radon Action Month, and the aim of National Radon Action Month is to increase public awareness of radon, promote radon testing and mitigation, advance the use of radon-resistant new construction practices, and we also encourage everyone to take action and learn the facts about radon. We'll begin by covering some basic information about radon. Following the radon overview, we will have a panel moderated discussion, information on state radon programs in Colorado, Indiana, and Missouri, and we'll conclude with a Q&A session where attendees can ask the panelists any remaining questions that we have time for. If there are any questions we do not get to during the program, we will make sure to follow up with attendees promptly and provide detailed answers. All right, so let's jump in. What is radon? Radon is a radioactive Class A carcinogen, meaning there is enough data to conclude that it can cause cancer. Radon is colorless, tasteless, and odorless. And when it's inhaled, radon particles become trapped in your lungs. Over time, the particles break down and damage lung tissue and alter the DNA of the cells. Radon is the leading cause of lung cancer in people without a smoking history and the second leading cause of lung cancer overall. Radon-related lung cancers are responsible for an estimated 21,000 deaths annually in the US, and prolonged radon exposure is a serious health concern. Radon is a naturally occurring gas that is found in the byproduct of the radioactive decay of uranium found in rocks and soils throughout the world. As it escapes from the ground, it's emitted into the air. Once it's formed, radon enters a home through cracks in walls, basement floors, foundations, and other openings, such as the water supply. And as radon decays, it releases radioactive byproducts that are inhaled and can cause lung cancer. Because radon comes from rock and soil, it can be found anywhere, including both old and new homes and buildings. Many people mistakenly think that only old homes can have issues, but new homes that are sealed tight can actually trap radon even more. Exposure to limited concentrations, like those found outdoors, is impossible to avoid. However, when radon gets trapped inside, it can exist in dangerous concentrations. And an individual's probability or risk of lung cancer is based on how high the level of radon to which they are exposed, as well as the duration of the exposure. Radon is so dangerous that the Surgeon General has issued a warning similar to the warning label that's placed on cigarettes. Similarly, the American Lung Association, the American Medical Association, the Indoor Environments Association, formerly ARST, the EPA, World Health Organization, and several other experts in health advise that elevated radon should be lowered. While most Americans are generally aware of the danger that cigarettes pose, they are unaware of the deadly link between radon and lung cancer. Radon gas is measured in units called picocuries per liters of air. According to the Environmental Protection Agency, or the EPA, the average indoor radon level is about 1.3 picocuries per liter. The ultimate goal is to get your radon level to the lowest level possible, and any level between 2 to 4 picocuries per liter indicates that action may need to be taken to reduce health-related risks. The EPA recommended action level is 4 picocuries per liter. As far as lung cancer statistics, lung cancer is the leading cause of cancer death in the US, and it claims nearly as many lives every year as breast, prostate, and pancreatic cancers combined. In 2026, it is estimated that in the US there will be 229,410 new cases diagnosed, and 124,990 people will die from lung cancer. Overall, the chance of a person developing lung cancer in their lifetime is about 1 in 19, and 20,000 to 40,000 lung cancers each year happen in people who never smoked or smoked fewer than 100 cigarettes in their lifetime. Lung cancer is the leading cause of cancer deaths in women, surpassing breast cancer in 1987, and approximately 1 in 5 women diagnosed with lung cancer do not have any smoking history at all. As far as lung cancer statistics, it's important for us to briefly cover the eligibility criteria for lung cancer screening. The U.S. Preventive Services Task Force, or the USPSTF, advises that adults ages 50 to 80 who have smoked for at least 20 pack years, meaning a pack a day for 20 years, or 2 packs a day for 10 years, anything that adds up to a 20 pack year history, and currently smoke or have quit within the past 15 years should get an annual lung cancer screening with a low-dose CT scan. It's important that you talk to your doctor to see if this screening is right for you, if this is something you're concerned about, and fall into these eligibility criteria. Moving back to radon and lung cancer. Unlike guidelines for smoking history and lung cancer screening, guidelines for radon exposure and lung cancer screening do not currently exist. Our teams work hard to advocate for lung cancer screenings to be updated to include things like radon, secondhand smoke, occupational exposure, and other causes, but we have a great deal of work to be done in order to ensure these are included. If you're exposed to radon and do not meet the screening eligibility criteria mentioned on the last slide, but are concerned about your exposure, we recommend discussing this with your healthcare provider and detailing the level and duration of exposure to determine if a low-dose CT scan should be completed. A radon level of 4 picocuries per liter, which again is the EPA recommended action level, which means that you need to take action to reduce that level in order to protect your lung health, is comparable to smoking about 8 cigarettes a day or receiving 100 x-rays per year. And radon exposure that's coupled with smoking actually increases the risk of developing lung cancer about tenfold, depending on the rate at which an individual is smoking. Radon levels as high as 285 have been recorded in Missouri, which is equivalent to smoking over 40 packs of cigarettes per day. As a reminder, nationally, about 1 in 15 homes are estimated to have high levels of radon, according to the EPA, sorry. 1 in 2 homes in Colorado have elevated radon levels. And in Colorado, there are over 2,300 new lung cancer cases every year, with an estimated 500 of those cases that are attributed to radon. Colorado has been working hard over the last several years to implement policies to reduce radon exposure and require professional training and certification. 1 in 3 homes in Indiana have elevated radon levels, and in Indiana, there are over 5,000 new lung cancer cases every year, with an estimated 1,000 of those cases attributed to radon. Indiana also has strong radon policies requiring professional training and certification, homebuyer protection, and school testing. Now, taking a look at Missouri, 1 in 3 homes in Missouri have elevated radon levels. And in Missouri, there are over 5,400 lung cancer cases annually, with an estimated 850 of those cases attributed to radon. Missouri does not currently have any statewide radon policies that protect residents from radon exposure or require professional training and certification. Every home should be tested for radon, and radon has been found at elevated levels in homes in every state. The only way to know is to test. The age, location, exterior type, and foundation do not determine if a building has radon. So the best way to know is to just test your home every 2 years. Also, elevated radon causes no symptoms until lung cancer symptoms begin to develop. The cost of professional radon testing may vary from one state to the next and depends on the size of the home or building. But on average, the cost of a professional radon test is somewhere in the range of $140 to $200 and is a great option for radon testing. You can also purchase a radon test kit, and state radon programs may have free test kits available to residents. Following our panel, we will share some QR codes and links where participants from Colorado, Indiana, and Missouri, as well as other states, can order test kits through their state radon programs or other reputable sources. All right. So moving into radon testing, how is radon detected? So again, the only way to detect a buildup of radon in your home is to test the air. Various forms of do-it-yourself test kits, as well as digital detectors, are simple to use and inexpensive. If you prefer, again, you can also hire a certified radon testing professional. And the best way to find a certified professional is to contact your state radon program. The EPA also has an interactive map with contact information for state radon agencies. As far as the types of tests, there are several different ones. Passive test devices do not require power to function, while active test devices do. Passive devices include things like alpha track detectors, charcoal canisters, and charcoal liquid scintillation detectors. Active test devices include continuous monitors. Short-term tests typically take 2 to 7 days, but can sometimes take a few weeks for results. Long-term tests tend to be more accurate as they collect more data over a longer amount of time. They take at least 3 months and measure long-term averages. If you don't want to wait for a long-term test, short-term tests can indicate if your home has a problem and let you know if you need to do any follow-up testing. As far as where and how to test, when you're testing your home, you want to make sure to place the kit in a location where it will not be disturbed in the lowest level regularly used in your home. Make sure that you follow the test directions and any other official guidance to prevent problems that can affect the testing. Digital detectors can also be purchased. Digital detectors can also be purchased and can provide both short-term and long-term readings. Testing anytime during the year is fine, but testing during the winter months will yield the most accurate test results since your home is closed up and windows are not kept open, allowing outside air to interfere with the results. Knowing where and how to test is key when it comes to radon. Do-it-yourself testing can be tricky, so the graphic here on the screen highlights some of the best practices for using radon test kits. For example, you want to keep the test kit 6 to 8 feet above the floor if suspended, 20 plus inches above the floor if it's sitting on a table, 3 feet from any outdoor openings, 1 foot from an exterior wall, away from things like heat and drafts and humidity. So again, there are really specific ways that these tests need to be used in order to give you an accurate result. If your do-it-yourself test kit shows elevated levels of radon, it might be a good idea to hire a professional to do testing to confirm the level. So how do we protect ourselves from radon? If you have an existing home with elevated levels of radon, you can fix the problem by having a radon mitigation system installed. A radon mitigation system consists of a vent pipe, fan, and the proper sealing of cracks. This system collects radon gas from underneath the home and vents it to the outside. If you need to have a radon mitigation system installed, it is essential to contact a certified radon mitigation professional to do the installation. And again, a list of certified professionals can be obtained by contacting your state radon program. Even with a mitigation system installed, radon testing needs to occur regularly every 2 years. And a quick note on continuous monitoring systems. If you purchase a continuous monitoring system, please note that there's not enough data for the National Radon Action Program to verify the effectiveness of these devices. Always make sure to purchase a quality device from a reputable company and not the cheapest device that's available on Amazon. Continuous monitoring system results need to be verified by a professional or lab testing, again, at that same 2-year frequency. And these monitoring systems, like smoke detectors or CO monitors, have a lifespan and need to be replaced periodically. They also need to be calibrated in order to work correctly. Another note with these is that moving the device throughout the home will create unreliable results due to averaging tests from different rooms. So again, just some intricacies to be aware of with these devices. Mitigation systems themselves need to have regular maintenance like the other systems in your home. So HVAC, for example. Radon mitigation systems work and can help prevent lung cancer. And if you're building a new home, you'll want to ask your contractor to install radon-resistant features. And these features include things like gravel and plastic sheeting below the foundation, along with proper sealing of cracks and the installation of a vent pipe. Once the radon-resistant features have been installed and the home is completely built, you want to make sure to perform a radon test as the levels could still be elevated. If the radon levels are still elevated, a radon fan should be added to the system to lower the radon level. Again, please feel free to put any questions you have in the chat, as Sarah mentioned. For now, we'll move into our panel portion of the webinar, but all of your questions will be addressed during the Q&A portion following the panelists. All right, so our first panelist today is Kyle Davis. Kyle is the operations manager for Protect Environmental Littleton. His first 8 years were spent in Michigan, and in 2023, he moved to Colorado. Protect Environmental and Kyle have performed mitigation and measurement projects in residential and commercial buildings across 48 states. Thank you, Kyle, for joining us this afternoon.
Thank you for having me.
All right, so we'll go ahead and jump in with our first question. So what do you do if you have high levels of radon? How do you mitigate it, and how much does it cost on average to fix the problem?
Once you find out that you have elevated radon levels, first step should be looking at radon mitigation companies. NRPP has a great feature on their website, which you can put in your zip code and it'll show you certified mitigators in your area. Just like any other change you're making to your house, any other service you're having performed, it's a good idea to have 2 or 3 different companies, either come take a look at it or at least contact them and ask them some questions about what you have and things like that. Typically, companies are going to ask a pretty standard set of questions: the age of the house, the style of house, is your basement finished? Do you have crawl spaces? Things like that. And typically, they're going to want to come take a look at it and see what you have and go over kind of a plan for each house individually. You may be more comfortable with one mitigator than others, and that's why it's better to have a few come out. Prices can vary. The same system may cost a few $100s different between different companies. The cheapest is not always the best. It's more of a comfort and how you feel their knowledge base is based on your given situation. Typically, radon systems are going to cost around $1,000 for a pretty standard system, and they can go up to about 2,500 for a more complex system that may have different foundation types, including crawl spaces, like if you have a tri-level, something like that, where you have multiple areas that need to be connected together. Those can get a little more expensive. And then if you have to seal a crawl space, those, I would say somewhere between 1,000 and 4,000 if you have a very large crawl space. So you're generally going to be in that 1,000 to 2,500 range. Radon systems are kind of counteracting the opposite effect that your house is already doing. As we've all know, heat rises. And so when it's doing that, it is pulling up on the ground, which is where radon comes from, and pulling it into your house. Radon system is creating a negative pressure underneath your house and removing that air before it gets into it. And so that can be accomplished a few different ways depending on your house style. It can go through your basement slab, which is coring a hole through the concrete and creating a suction pit underneath, as the diagram on the last slide showed. It can be tying into a drain tile system, depending on where your house is at in the country. You may have that, which are quite effective, or it could be tying into a crawl space. Those are the three most common. Every house is a little different.
Perfect. Thanks. Yep. Definitely a good reminder to do your research, just like anything else on the home. What about if somebody lives in a rental property or an apartment building?
So if you live in a rental or an apartment building, if you don't know if you have high levels or you want to know, generally good practice is contact the landlord. Let them know you want to have a test done. We all know landlords can be different everywhere, and some are more receptive to these things than others. If you ever get any pushback, you can perform a test yourself to know if you have a problem. Depending on where you're at in the country, Colorado has specific laws that if they don't want to allow you, or if they don't want to install a mitigation system to fix a problem that has been identified, then you can break your lease. That's going to be different state by state. Most landlords want you to stay there to keep paying your rent. So for $1,000 for them, generally they're going to work with you there.
Perfect. So moving back to talking about homes specifically, and we mentioned this a little bit in the overview, but what areas of the home tend to have the highest concentrations of radon, and why is that?
Typically, it's going to be a basement or the lowest livable level. Radon is coming up from the earth. So the closest contact to that is likely going to be your highest source. Basements over crawl spaces. If you have a basement and a crawl space, it is recommended to test the basement and the crawl space at the same time. And as radon enters into the house and moves its way up, it is heavier than air, so it naturally wants to sit in the lowest level. The air moves in your house. So you're going to get some radon that's going to move up to upper levels. It should be a reduced amount that is getting up there. So really you're testing at the source and then mitigating at the source.
Then our next question. So, if somebody has a new home with no noticeable cracks or gaps where radon can enter, do they still need to test their home?
Certainly, that is a common misconception that new houses are just not prone to these kind of issues, and that older houses that have old foundations and old slabs where there are breaks in it are the only ones that run into radon problems. Newer homes are designed for good drainage, things like that, that help keep water and other things away. Those things also can promote air to get into the house a little easier through the foundation. They're sealed up better, so less fresh air is leaking through windows and things like that. Every house should be tested.
And can you talk a little bit more about why testing should be done every 2 years?
Simply, things change. If you have, if you're doing a test today and you do it for 48 hours, that's a test to let you know what your radon levels are over 48 hours. If you're doing a longer term test, again, it's just over that period. So things will change. Uh, if you have a mitigation system, fans stop working. There are things that change in them that you may not have noticed. There are plenty of stories of people who go to sell their house and they have a system in and they test high when they go to sell, and they call and say, I've lived here for 20 years and I thought this problem was taken care of. And they didn't know that the fan died 10 years ago and then it's just been out there. It's simple enough and cost effective enough to test. The more testing you do, the more information you have to work with.
All right. Well, I'm just checking the chat quickly to see if we had anything else that came in that we can address now before we move into our next panelists. Let's see if I get anything from our
I
other
think there
co-hosts.
there was a question about any resources for folks who find out that they have high levels, but perhaps can't afford the cost of mitigation.
That will depend on the state you're in. Colorado has a lovely program referred to as the LRMA program, which is a low income radon mitigation assistance program. And that one, you essentially apply for it and you have to own the home. That is a function of it. And they mitigate hundreds of houses a year with that. So it depends on which state you're in. Colorado specifically does have a phenomenal program.
Perfect. Yes, we definitely are a little bit jealous in Missouri. We don't have a program like that, but it's a great example of some things that our other states could adopt. All right. Well, thanks, Kyle, again for joining us. And we will move into our next panelists.
Thank you.
All right. So our next panelists today are Dr. Kevin Everett and Misty Phillips. Kevin Everett is Associate Director for Prevention, Control, Outreach, and Engagement at the Ellis Fischel Cancer Center and Research Director of Family and Community Medicine at the University of Missouri School of Medicine. He has over 25 years of experience leading tobacco control and cancer prevention initiatives with a focus on youth prevention, cessation, and community-based interventions across Missouri. Misty Phillips is Manager of Research Activities in the Department of Family and Community Medicine at the University of Missouri School of Medicine. She has more than 20 years of experience in public health and cancer prevention and currently serves in leadership roles with the Missouri Cancer Consortium, advancing cancer prevention initiatives statewide while pursuing a PhD in population and precision health. Thank you, Dr. Everett and Misty, for joining us this afternoon.
My pleasure.
All right, so jumping into our first question here, can you talk a bit more about the lung cancer risk for tobacco use and radon exposure combined?
Sure. And you described this a little bit in your slides, but those who smoke or have a history of smoking, their risk of lung cancer is significant as the leading cause, but it also is interacted or synergistic if they're exposed to radon. And so for about for this population, about 62 people in 1,000 will die of lung cancer. And that's compared to like 7 people in 1,000 who are never smokers. I guess another way to look at it too would be a person who never smoked and who is exposed to 1.3 picocuries per liter has a 2 in 1,000 chance of getting lung cancer, while the person who currently smokes or has a smoking history, they have a 20 in 1,000 chance of dying from lung cancer.
Thanks, Dr. Everett. What about the eligibility criteria for lung cancer screening? I know we went through those earlier in the slides, but I think it's important for us to repeat those.
Sure. So the lung cancer screening is exposing and having a person use a low dose CT, and it's recommended for adults who are between the ages of 50 and 80 and have a 20 pack year smoking history. So a pack year means you smoke 1 pack a day for 20 years. It could also mean you smoke 2 packs a day for 10 years. So that's how you get to a pack year. So you got 50 to 80 as age, and then your pack year history. And that could be someone who's currently smoking or has quit within the past 15 years. Those are the people that are recommended and eligible for lung cancer screening.
And for those people who are considered high risk and recommended for that screening, what percentage or number of people are eligible for lung cancer screening, and how many of those people are actually being screened?
Sure, I'll take this one, Rachel. So national estimates for the United States suggest that actually around 12.8 million people are eligible under the U.S. task force recommendations, but only 19% are actually screened. But here in Missouri, there's about 19.2% of people who are considered high risk for lung cancer that actually get screened with the annual low dose CT scans. That rate is pretty much on par with the United States average, which is around 18.2%.
And what if someone is concerned about lung cancer risk but doesn't meet the eligibility criteria for screening?
Sure. Well, they can take time to talk with, their healthcare provider, whether that's primary care or whoever kind of sees them for most of their healthcare about their own personal risks. So that might include their family history, if they've ever had any radon exposure, any occupational risk, anything of that nature, so that they can do some what are called like risk reduction steps, like smoking cessation. And then, of course, radon testing is strongly recommended. And then, of course, any symptoms should always be promptly evaluated by their healthcare provider as well.
And why is it important that lung cancer survivors are concerned with testing their homes for radon and making sure that they reduce their radon exposure?
Sure. So that's a good question. But with lung cancer survivors in particular, having a lung cancer diagnosis, being able to test the home for radon should be a priority. So that way they can ensure that there's not high radon levels in the residence, because radon actually remains a lung cancer risk even after treatment has occurred. And so survivors could potentially be a little bit more vulnerable to a new primary lung cancer. And so therefore, like radon testing and mitigation are just really simple strategies that could help to reduce a person's ongoing risk for both the survivors and, of course, those that are living in their households as well.
All right. Well, thanks, Misty and Dr. Everett. I'm just going to do a quick check and make sure if there are any questions that have come into the chat that we can address right now. And if not, we will move into our next panelist.
I see one question about if they have high levels but can't afford the cost of mitigation. And so at the Department of Health and Senior Services, they have a radon program where they will actually work with individuals to try to find resources to help them offset some of those mitigation costs.
Perfect. So not quite the program that's in Colorado, but definitely something that's available for additional assistance.
And I'd be remiss, because it's just my career, anyone you know who smokes, every state that's mentioned here has quitline services that are state sponsored and free, and really encourage people to access and use those. Local health departments frequently have evidence-based programs as well. Encourage anyone who's smoking to quit. It's one of those risk factors that not only lung cancer, but a host of other medical problems can be averted if you can get someone to quit. Thank you.
Yeah, of course. It's another great point and resource, and we can make sure to share some of that information out to folks after the program as well. All right. Well, thank you again, Dr. Everett and Misty, for joining us, and we will move into our next panelist. All right. So our final panelist for today's program is Heidi Naffman-Onda. Heidi is the co-founder of the White Ribbon Project, which is an organization dedicated to promoting awareness about lung cancer by changing public perception of the disease. Heidi is a lung cancer survivor and was diagnosed with stage 3A non-small cell lung cancer in October of 2018. Heidi seeks to encourage other lung cancer survivors and advocates to mobilize their efforts to increase awareness about lung cancer, change the public perception of the disease, and to work to help improve prevention, early detection, and treatment of lung cancer. Heidi has also been part of our webinars for 5 years now, so we really appreciate her always joining us. And thank you, Heidi, for joining us again this afternoon. And then I will pass it over to you to share your story with us.
Great. Thank you, Rachel. Thank you, everyone, for giving me the opportunity to share my story and hopefully save some lives. Being a lifelong health enthusiast, health educator, and a fitness trainer, married to a primary care physician, my family and I, next slide, please, were blindsided by my stage 3A lung cancer diagnosis in October of 2018. The really scary thing about this was I had no symptoms, and this was an incidental finding while investigating a different health issue. I couldn't believe it when I got this phone call that told me, you have stage 3A inoperable lung cancer. There's no hope for you. You don't have a biomarker, lots of other specifics about treatment options now I didn't qualify for, they told me, and I should get my affairs in order, possibly with 4 to 6 months of life left. I could not believe what I was hearing because I felt great. I felt the best I'd ever felt in my life. And when I met my oncologist, though, I was given so much more hope. I was told that there was a new immunotherapy that had just been FDA approved about a month prior to my diagnosis. And after chemo radiation, 3 months of that, I could get these immunotherapy infusions every other week for a year, and with curative intent. So next slide, please. So I'm sitting here today. You can see the first slide, catch there in October 2018, and my most recent scan in October of 2025, because research matters, and I'm very, very grateful for that. But how did I start to put the pieces together to radon? I had no smoking history. I'm a vegan. I'm just a total health enthusiast my entire life, and I raised my family in this home. And when we had to tell our 3 adult children that I had lung cancer and it was, a bad situation, our son, who is an environmental engineer, asked me what the radon level of the house was. I had no idea what he was talking about, originally from California, and we had been living in Colorado in this house about 20 years. He gave me a quick education, we tested, and we were twice the level of what the EPA considers to be actionable. And the thing that came into my mind first was my children. Next slide, please. You'll see a picture here of lots of adults and some babies. This is my family. And my thought went to my kids. they spent much more time in the basement than I ever did. It was the preschool hangout turned into the, eventually the college hangout, bringing friends back. And I would go down there, maybe once a week to pick it up. But they spent a lot of time there. And I'm so worried that they could be walking around with lung cancer right now, and they do not fit the eligibility requirements. So here I am, 7 years later, more than 7 years later, with no active evidence of disease. But I want to let you know what that cost us. It's, turned our lives upside down. I'm not done with this. I'm not cured. This could come back at any time. I'm surveilled rather closely, and surveillance in itself is a risk factor for a new primary. I worry about my kids who are not eligible to get screened. And if you're worried about the price of this, I would really look into this. When we had our house mitigated in 2018, about 5,000 square feet, it was $950. The cost of my care, I never spent a night in a hospital. I did not have surgery, but I had very expensive drugs. And I haven't even calculated the amount, what surveilling has cost over these last 7 years, and multiple health problems as a result of some of the treatments. But my care for that 15 months was about $750,000. What a return on investment to not ever have to go through this. My words to you are to urge you to test. Please don't guess what your situation is. If you do require mitigation, get it done. Don't walk around with a black cloud over your head like I will and my family will the rest of our lives. There is help out there. Test, don't guess, fix if needed, save a life. Thank you.
Thank you so much, Heidi. Again, we really appreciate you for sharing your story, and we're so glad to continue to have you join us for these programs, and that we can say that it's been 5 years since you've been with us. And, we think that the message of making sure that you test your home and that if you have an issue, you mitigate it, and the amount of time and money and energy that can save everyone is just a really important, piece for us to make sure that we are leaving everyone with today. So thank you again. So we're now going to cover some state-specific radon program information and test kit ordering info before we move into the Q&A. So I think we were having some issues with our chat. So make sure if there's anything that you want to ask that you have entered that into the Q&A. So again, that button at the bottom of your screen. And we will go through some resources and then move into that. All right. So, and we are also going to post these in the chat for everyone to check out. These are Colorado Radon Program resources. We've got the website, the Low Income Radon Mitigation Assistance Program that Kyle was talking about, as well as the program email for that, and the Colorado Radon Dashboard. So again, these will be posted in the chat, but make sure that you're checking out these resources in your state. And then Indiana, we've got the Radon Program website as well as the Radon Hotline. These will also be placed in the chat for you to review. And we will also send these out in our follow-up email, all the links that were shared during today's presentation. Then moving into Missouri, we've got our Missouri Radon Program website, our Missouri Radon Dashboard, and our Radon Program email. So those will also be listed in the chat for you, as well as the follow-up email. And then finally, so it is time to take action and have your home tested for radon. So once again, there are free test kit programs for residents in Colorado and Missouri, as well as discounted test kits for residents in Indiana. You can scan the QR code for your state to be directed to the test form, and we will also post the links in the chat just in case you prefer not to use the QR codes or aren't quite that tech savvy. For participants who might be joining us from other states, there are test kits available for purchase through Alpha Energy Labs and the American Lung Association. There's a ton of reputable resources out there where you can purchase test kits. You can also purchase them from retailers, as well as, like we mentioned before, have your home tested by a certified professional, as we mentioned throughout the program. So we're going to put some links in the chat, including those test kit options, as well as some places where you can go to find a certified professional in your state outside of contacting your Radon program. All right, and I just want to give everyone a minute to capture that. Okay, and again, these will be shared in our follow-up email. So before we move into our Q&A session, on behalf of the Missouri Lung Cancer Coalition and our partner organizations, thank you to our panelists and our audience for joining us this afternoon to learn about this important lung health issue. We'll now move into our Q&A session.
Hi. Okay, so I have been trying to answer most of the questions in the Q&A. As you'll see, I have, and we will continue to post those additional links in the chat there as well, the links that were referred to by the Colorado team. The first question that came in was about the feasibility of conducting the testing in apartments on the third floor. Based on the EPA's recommendations, they do recommend testing for all homes and units below the third floor, but that's not to say that you have to, you can still have a test done on the third floor. So it's important to have it done if you're at all concerned, particularly if there is a reason to suspect that the lower units are potentially affected. So definitely reach out. And the test is very quick and very easy. So it's not, there's no harm in testing. The second question that came in was asking about tests to specifically attribute your lung cancer to radon. And that's where it gets kind of tricky. It's really hard to describe causation or to prove causation. It's nearly impossible to go back and say your cancer was caused exactly by this particular exposure or this particular cause. So while there isn't a specific cause, often you'll hear, and I posted a link to a really good blog by the ALA that Rachel's probably familiar with. But what usually happens is there's no other logical reason for you to have been at risk for lung cancer. There's no other known environmental exposures, no family history, no smoking history, no secondhand smoke exposure. If nothing else fits, it's often, and your home happens to have tested positive for radon or your place of work. We don't often think about that, but many of us, spend a significant amount of time in our workplace environment. And how many of us know if our workplace has been tested? So that's an important part to take into account. And as Heidi mentioned in too, schools as well. There are different sets of testing requirements for schools. So it's important to know that there are, and this is usually a part of the state programs. I believe here in Missouri, we have a separate state program where the schools are required to undergo regular testing for radon, just to make sure that all of the employees and the staff and the kids are all safe there. Let's see.
And Sarah, before you move on, there was another question that came in that I think might be related to the one you're answering right now, that says, but what if the patient does not have a smoking history?
Yeah. That's often the most challenging and the most frustrating part. And Heidi probably knows this firsthand. You often don't get a definitive answer as the patient. Nobody can tell you why you got cancer. And that goes for anybody. It's really hard. And we all want to know the why. But the way I kind of approach the situation is to just try to make sure that regardless of whether or not you have cancer or you have a family member affected, we all just want to make sure that our indoor air quality and our indoor air environment is as healthy as possible. And this is a very simple, quick test that you can do just to give yourself that peace of mind that this is not an exposure that you're going to have to worry about. There was even a news story just this morning about this whole concept that's very popular in Europe of kind of burping your house, opening up the air, letting in fresh air at the beginning of every day. And it's so novel. We think, oh, that's so inefficient. We're wasting energy. We're doing this and that. Sometimes being too buttoned up and having the house too well insulated can trap some of these chemicals in our air. So it's just being aware of kind of the in treat and treating your indoor air quality as, something that you have control over, something that you can be actively monitoring. Just because you can't see it doesn't mean it's not there.
Absolutely. And we had a new question come in. Can radon cause other types of cancer besides lung cancer?
There isn't definitive data, but what they do know is that because it is a known carcinogen, it can definitely exacerbate other existing cancers. So for cancer patients who have, I always recommend having their house tested for radon. Unfortunately, I've had a lot of cancer in my family, and I'm also very militant about making sure that all of my family members have had their houses tested, because it's again, you're immunocompromised, you're more susceptible. So going home to a home that has a potential carcinogen in it, whether it's radon or asbestos, which was another question in the chat, just being aware of what is potentially surrounding you and could be potentially an additional unnecessary exposure, that's going to be critical. But yeah, it's very difficult to attribute it to other specific cancers, really because it's a gas. That's why it tends to affect our lungs most specifically, but it definitely can affect other cancers as well.
I do think radon exposure is linked to some other health conditions, not just cancer. I was trying to think. I think it's a type of stroke. Sometimes they think is associated. Again, not a lot of research though. I mean, the
Mhm.
clearest research is around radon and lung cancer.
Oh yeah, Heidi.
Yes, I just wanted to make one thing clear about my story when I mentioned that I wasn't in the basement very often, but 2 years before I was diagnosed, we became empty nesters and we turned that basement into a cardio gym space. And I was
Mhm.
on my elliptical every single day of the year for at least an hour. I would put on a movie and I would, go on the weekends even longer. And then 2 years later, I have late stage lung cancer. No, we
Mhm.
can't prove that radon absolutely caused that. Maybe there was some other, I grew up in Los Angeles when it was the smog capital of the world. Maybe there's multi-factors. You also cannot prove with 100% certainty. You cannot say that someone with a heavy smoking history absolutely got
Mhm.
that lung cancer because of cigarette smoking. Maybe they
Mhm.
were predisposed to somehow get it because most people, it's like 80% of people with heavy smoking histories, and please chime in, subject matter experts, never develop lung cancer.
Mhm.
So just mitigate all the risks.
Yeah, yeah, that causation piece and we're all so I think it's sort of natural human tendency to want to know why. So we're always seeking like what could I have done differently? But I think the goal is, from us with Rachel and I being a part of the prevention team, we're always really focused in on what can we do to prevent it? What can we do to avoid it in the first place? And this is a quick and easy step that's very non-invasive, and it doesn't take much time at all to set up the test and to just have that peace of mind.
And then we had one more question that's come into the chat, and it looks like we're getting another one after that. Oh, I just had one disappear from me.
Oh yeah, I believe it
We'll
was
scroll
in
down to
the
it. Yeah.
answered tab.
I was
So
getting ready to answer it, Rachel. I plopped it right there for you.
okay.
You got it.
It just says this question has been answered live.
Oh yeah.
No, it's in the Q&A if you look
Okay.
at the webinar chat.
Okay.
So
Um,
it says I schedule a low dose lung cancer screening in Illinois and I'm unaware of the guidelines for eligibility. How can a patient qualify for lung cancer screening if they do not have a history of smoking cigarettes? And then how can we get these screenings covered by insurance? That's the open one.
Yeah. This is a challenge that we've often encountered in our lung cancer groups and in our work teams. There are options to pay out of pocket, but for anyone with symptoms, there is a way that they code it differently in the medical billing process. So if somebody is symptomatic, but they don't meet sort of the traditional criteria, but they have other lung related symptoms, it's possible to still have that test ordered and covered by insurance based on the symptomology. You'll see like sort of a different diagnostic code in billing. But there is a out of pocket. You can always opt to do the out of pocket costs as well. I'm not sure if anyone else has any experience with the navigation piece and the insurance piece. Oh yeah. Yeah, if they're symptomatic, it's all about the terminology. Like what I found is in some cases, like for myself, I was ineligible for a screening because I had symptoms, but I was still eligible to have a test done. But it was coded as a diagnostic test based on the symptoms. It's really important to have that conversation though, and to not be afraid to talk to your doctor when you're experiencing symptoms that you want to have checked out, to keep advocating for yourself. It's, that is not, that is your right, and you should make sure that you're feeling like you're being heard.
all right. So just a lot of thank yous. And then Misty, I know you're typing an answer, but I think this might be a good one for Kyle to address as well. Um, it says, I live in an open concept home with bedrooms upstairs and a basement. Should I test all levels of my home?
There is no harm in testing all levels. You are
Mhm.
unlikely to see elevated levels on upper floors. So the basement would be your best shot. Generally, if you have bedrooms in the basement, I say that's your spot. You're going to spend most of your time in that area. If you don't have that, you're just a general area. If you have a living, like a den area down there, that's a good one. Usually what you're trying to do is identify areas where you're spending the most time, breathing the most amount of like air, like a mechanical room is not a
Mhm.
recommended spot. You're not going to spend time in there. Uh, but livable areas, living areas. There was another question that came through that I didn't really touch on earlier, and that's how often should you test? And the
Mhm.
recommendation is every 2 years. All three of the states that are focused here are Midwest states who happen to have the benefit of all 4 seasons. If you do not have a mitigation system, or if you do, and you test in a warmer season, it is a good idea to test in the winter. There's a lot of different factors that kind of go into why you would do that, but the main one is your house is heated more in the winter and naturally is going to have a
Mhm.
larger negative pressure on it because of the pressure differential between outside and inside. A lot of times you will see elevated readings in the winter, but not in the summer. You're not going to have windows and doors open. People aren't going in and out as much. It is a good idea to test multiple seasons since it is a fairly cost-effective thing to do.
And then
And
we
the
have
question,
one more.
yeah.
Oh,
Oh no, go ahead.
we have one more that came in getting a couple more. We'll see what we can get through while we're still running here. Can radon testing be done in mobile homes?
It can be. The you depends kind of on the situation for it. Um, I'm not extremely familiar with the process of trying to mitigate something like that, but as far as I know, it's kind of a void space underneath and then concrete down there. The likelihood of a high test there is fairly small, but no harm in doing a test.
All right.
And thank you so much for sharing your navigation experience. That is, it just goes to show like it's that self-advocacy, like keeping with it and having a good healthcare team that's willing to help you navigate through that process. Sometimes, the insurance is a good thing, but it's also extremely frustrating as far as trying to get the test that we all know that we need done. But sticking with it is vitally important. There are, as far as advocacy work for this, American Lung Association has been one of our best partners in really trying to push this work forward. Nearly every state here, and I know every state here on the call has different groups. So check with your cancer consortiums, your cancer partnerships. If there's a comprehensive cancer center that's a part of those teams or within your state, you can definitely reach out to them. We're all huge fans of low dose CT. We all think it should be offered as just sort of, we offer colonoscopy to anyone with a colon. Why aren't we offering low dose CT to anyone with a lung? That seems like a no-brainer there. So I am definitely on the lookout and trying my best to kind of push that narrative forward. But there are other people who are also coming to that same conclusion because it's very frustrating for non-smokers to be kind of lumped into the same group and to have not had access to screening that they probably would have taken advantage of had it been available.
And Heidi also added about connecting with the White Ribbon Project as
Oh,
well.
yes.
All right. Well, we're at the top of the hour. It looks like one of the last questions was, will the webinar be available so you can share it? Absolutely. It's being recorded and we will share it out with everyone following the close of the program. All right. Other than that, I don't see any other. Oh, looks like there was maybe one more unanswered question. About the furnace, and does that push radon throughout a 4-level home?
There certainly are unique situations where radon can get pushed throughout the home in different ways. Radon and water is one of them. Your HVAC can do that. Every HVAC, not everyone, but a lot of them have their own uniqueness to them. So it's hard to say exactly. It is possible. That's why there's no harm in testing an upper level at the same time as you test the lower level. It'll give you an indication of something like that because you should not see equal radon levels in the basement and the main level. That something is pushing it up there, and that would be a good identifier of that.
Mm-hmm.
All right. Well, thanks everyone for hanging out for a couple extra minutes and for all the great questions. If you have any follow-up questions, I see Sarah, you put your contact info in the chat.
I will navigate you to the rest of the team, so you don't have to worry about that if you don't have time to capture everybody's contact information.
Yes, and we also, like I said, we'll be sending a follow-up email. When you close out of the webinar, you will be asked to respond to a survey. We do ask that you please take just a quick minute to fill that out. It's 4 easy questions. We would love to have your feedback. Other than that, thanks again for joining us, and we hope that you have a great rest of your day.